with ROE Dental Lab, and you asked, we listened, and now we want to answer some of the frequently asked questions you have when it comes to our ROE Fit Trays. Now, if you haven't checked out any of our previous videos on the ROE Fit Tray, we're going to have them linked in the description below. I highly recommend you view them. It gives some more context as to what is the tray and even gives a live demo of record taking with our tray. But as most of you know already by now, the ROE Fit Tray is a tray that allows you to capture your primary impression, custom tray, and bite block records essentially all in one to make your denture appointments truly a two-step denture visit. So we want to talk about some commonly asked questions today after all the calls we got and discussions we had with you guys out there chairside. So here are some of the things we got asked. Kind of in the realm of how does it work. The ROE Fit Tray is a thermoplastic tray, meaning you can heat it to make adjustments to it. We also had some questions regarding sizes, which those do come in small, medium, large. I'll talk a little bit about ordering later on in this video, and graduating to the more important topic of how does it work. So the ROE Fit Tray is a thermoplastic tray that can be adjusted. So like I talked about earlier, it's going to be the heat and adjust. So you can have a warm water bath, soak the tray in the bath, then you can expand it, trim it, clip it to make adjustments to widen it, whatever necessary changes you need to make the tray more customized for your patient. Once it's cool, whether you give it a couple minutes to cool off or rinse it in some cool water, you can then try it back in the patient's mouth to confirm that it does properly fit. We got some questions on what about the tray bottoming out, or kind of where you push it posterior, and again with the bottoming out, it gets to the base of the tray. In our demo video, which again is going to be linked below, we have George showing how to create tray stops to prevent that from happening. The most frequently asked question we got is border molding necessary? Here at ROE, we want to make you the best final product we can, and what that means is the best records from you guys. So please take the time to do some border molding, whatever material you would like to use to make sure we can capture those extended borders for your wash impression. Another great question we got is case submission. So there's a couple different ways you can get your ROE Fit Tray records to our team here at ROE. If you're digital in your office and you've ever done a duplicate denture, or maybe you haven't, we ask that you send a 360 scan of that ROE Fit Tray just like you would for a duplicate denture. So we ask you capture it all in one scan, which we have some great videos on scan technique that we can link below on that as well. A 360 scan of the ROE Fit Tray once you've marked your midline, done your other markings, taken your wash impression and made any adjustments. So the Fit Tray is done, you're ready to submit, capture that 360 scan. We're also going to want an opposing and a bite. So make sure that you're sending 3 scans to us, a 360 of the ROE Fit Tray, a bite with the Fit Tray in, and then an opposing model for our team to use to work on your case. If you're looking to send it in the mail, that's totally great as well. Again, we want the same records. So we want the tray itself with the wash impression, the markings, and any occlusal adjustments. We also want the bite as well as an opposing model. You're welcome to send those poured up or in PVS if you'd like our team to pour it up here at ROE. And if you have any photos that you'd also like to submit, you can upload those through your portal at ROE or email those to photos@roedentallab.com. Again, there's never such thing as too many records, so if you are looking to submit your case, we ask for photos, the 360 of the ROE Fit Tray, opposing bite, everything we need to make your case as successful as possible. As far as how many visits does this entail, like we talked about earlier, you would have the ROE Fit Trays on hand ahead of time, so you would have your patient's ROE Fit Tray visit and then your final denture seat. And lastly, ordering and pricing. So if you would like to get some ROE Fit Trays in your office to have on hand for your next denture case, you can either call directly into ROE and a member of our customer service team can help place your order for you, or if you'd like to just order it quickly on your lunch break or in between patients, you can buy that through our shop as well. Now, what if something doesn't go perfectly at that final denture seat? Where does that take us from there? We do offer what's called a reverse reset. So for a discounted fee, we can reprint the denture for whatever that may mean. If the patient needed occlusal adjustments, if we might have opened them up a little too much and the patient decided they couldn't tolerate it, if the midline needs shifted, whatever that may be, know that at that second visit, if you can insert it that day, fantastic. If not, we can absolutely make changes here at ROE and print another denture for you. If you have any other questions, please feel free to call in the lab directly. We'd love to talk with you about your next denture case using our ROE Fit Trays. Thank you.